right, Deja, thank you. 6:30 this morning. We've been living in a pandemic for around 7 months now, and we know you have a lot of questions about the COVID-19 vaccine, when we could see it, how it would work.
So this morning, we're once again joined live by Dr. Dana Hawkinson, University of Kansas Health System, to help clear some things up for us. Doctor, good morning. You're good at clearing things up every time we have questions. All right, the FDA has said that once a vaccine is shown to be safe and at least 50% effective, it could be approved for use right here in the U.S. How is it effective if it's only working for half of the people? Is that a dumb question?
No, I think that's it's a pretty good question. We have to look at vaccine efficacy. That takes into account a lot of different things. Stopping infection, okay, so that's getting the virus and actually replicating the virus. Stopping disease, so that is manifesting any symptoms. Improving, sick days for work, so you're not missing work. Improving the rates of hospitalization. There's a lot of things that go into vaccine efficacy. It's not one single thing. Even for flu vaccine, a lot of times, we want 100% efficacy, meaning it stops the disease totally, so everybody is well all the time. What it does is reduce your chance of getting symptoms, getting moderate symptoms where you have to stay home from work, nobody wants to miss work, or even getting symptoms that cause you to have to go to the hospital. So we look at all those different things in vaccine efficacy. It's not one single thing. And the more disease that we can stop by the vaccine, so that is the symptoms that lead you to the hospital and to the ICU, the better. But vaccine efficacy can fluctuate depending on, especially for influenza now, not for COVID because we know influenza changes, but say for COVID, the ability to stop the person from having symptoms and also from spreading the disease as well. So efficacy takes into account a lot of different things.
What is the average efficacy on a vaccine? Do we often get that 100% efficacy, or is this kind of on par with what we see with the flu vaccine, this 50%?
Yeah, I think it depends what vaccine you're talking about, Lindsay, exactly. For things like hepatitis A vaccine or the measles, mumps, rubella vaccine, those are extremely good efficacies, up to 98, 99, 100% efficacy. For influenza, it's a little bit different. It varies year to year. What do we talk about again? Are we talking about just improvement in symptoms if you do come into contact with the virus? Is it decreased chance of going to the hospital or being on the ventilator? For the last influenza vaccine, I think it ranged from about 45 to 50%, and that is also because that vaccine carries 4 different strains of influenza in it. So when you look at the strains individually, it's a little bit different, but the total vaccine efficacy was different. Obviously, for the coronavirus vaccine, it's going to have just one component, and that is to the current coronavirus as it stands right now. So we're hoping the vaccine, obviously can be up to 100%, meaning anybody who gets the vaccine is going to be protected 100% from getting any symptoms and being able to spread that virus to other people. So when we talk about 50% vaccine efficacy for the coronavirus vaccine, we're going to be looking at the ability to stop symptoms, stop the ability for you to transmit the virus to other people, and of course reduce your chance of going to the hospital and having severe disease. We don't exactly know what that is going to be. We do know so far that the ones that they have published about look safe, and they do look like you are able to create a high enough antibody titer to get that protection, really to hopefully prevent the spread as much as possible, as well as individually prevent you from going to the hospital.
So, Dr. Hawkinson, I'm actually going to interview someone later this morning that's part of a trial right now. She's already received the vaccine, or it could be a placebo. She doesn't know what she's received, but she's part of the trial. If there are other people that say, hey, I'd really like to be part of this, is it too late? Are there still active trials that people can get involved with?
Yeah, we are still enrolling. We are, again, one of the sites for the AstraZeneca. We are still enrolling at this point in time. I don't know around the city if there are other sites for the other vaccine trials, but these trials are really trying to enroll a lot of people. They want people who would potentially come into contact with the virus and they want different demographic groups from age, race, ethnicity, and things of that nature. So as far as I know, you are still able to try and enroll in these trials moving forward.
Dr. Hawkinson joining us. Thank you so much. We know so many people have questions every day about these vaccines, so thanks again.